Hi there, my name is Rosemary Ford, System Director of Interpreter Services. Today I'm here with Kendall Reyes and Dr. Betancourt to discuss the COVID vaccine. Now it's really exciting that the COVID vaccine is available and ready to give out to the community, but we're still seeing that our marginalized populations are not getting the COVID vaccine due to a number of factors: communication access, misinformation, fear. So we're going to be discussing some of those things today.
I'm Dr. Betancourt. I'm an internal medicine provider with St. Joseph Hospital. I work in Daniel Webster Highway. I'm here with our ambassador, Kendall Reyes. We're talking today about the vaccine.
How you doing, guys? Kendall Reyes here. I grew up in Nashua, New Hampshire, and I am the ambassador for St. Joseph Hospital. And here with Dr. Betancourt talking about the COVID-19 vaccine and its affecting the community. Is the vaccine safe, and have you received the vaccine?
Yes and yes. I got my first dose in December the first week, and I got my second dose. I didn't have any major issues. Definitely, I believe the vaccine is safe. Now more than 60 million people had the vaccine, and we haven't had severe reactions. Then yes, I consider that the vaccine is safe, and I'm encouraging everybody to get it.
Great. And did you have any reactions? You know anyone that did? Or?
You can have some reactions with the vaccine. You may have some soreness in the arm. You may feel fatigue for a couple of days, but it's nothing like the condition. And we know that with the Latino population and African American population, we are seeing more severe cases of COVID, and it is important to get vaccinated. Here in New Hampshire, we're seeing that more than 20% of the populations are minorities, and we need to make sure that everybody is protected. Then yes, I believe we need to get people vaccinated.
What have you told your patients that are hesitant about taking the vaccine?
Yeah, that's a good question. A lot of people from our communities are afraid to get the vaccine because we don't know a lot about this vaccine. And definitely there is a lot of support showing the safety of this vaccine, and it's actually very promising that the vaccine will be used for other conditions, including cancers and hopefully a combination of other diseases that we can prevent with this type of vaccine.
Dr. Betancourt, why do you think there's mistrust or hesitation when it comes to the minority population when it comes to taking the COVID-19 vaccine?
Yeah, I strongly believe that that is a cultural aspect. People don't trust the medical field as much as other people. They also have, I believe that education is a big part of it. They don't know what is the vaccine, or they also are afraid of going or enroll to get the vaccine because they are afraid of the questions, they don't know the language. Then that's one of the biggest barriers also. It could be a very complex process for people to go and get the vaccine. Then that has been one of the biggest issues.
Yeah, and I've heard, and especially like with social media, there's so much misinformation out there. It's just really that much more important why the people in the community need to listen to our providers, listen to the people that are actually have the correct information, because that's part of why there's such a detriment in our communities. So for sure, I definitely understand that.
Yeah, you mentioned something important there is the miscommunication or the lack of the truth in the social media. In our culture, it's very common to believe that when they are getting the vaccine, they are being given part of the virus, and they are afraid that they are getting the disease instead of the solution. But with these vaccines, and especially with this type of vaccine, we are not injecting a virus, and we are teaching your body to react in case get presented to the real virus. And you are teaching, you are helping your immune system to recognize and act in a better way instead of getting the disease.
So to be clear, so when they're getting the vaccine, they're not actually getting COVID-19, the virus. They're getting something to help them recover from COVID-19. Is that correct?
That's right.
Absolutely.
Then they are not getting the disease. They are getting is just something to teach their immune system in how to react when they are presented to COVID-19. And that's another issue that people believe because they are having some side effects of the vaccine is that they are getting sick of the condition, but it's a completely different issue there. It's more how your body is reacting and how it's creating an immune response to the vaccine, but it's not that they are getting the disease itself.
So this is more of a personal question for me. So I actually spoke to my grandma the other day. She just moved up here, of course, in this last year. So it's been really tough. I haven't been able to visit her as much, but I talked to her on the phone, and she said that she's not getting the vaccine. I'm like, Grandma, why? And she was like, well, I haven't got the flu vaccine my whole life. And she's like, I've been fine. I might have got the flu one time. Would you be able to point out like really the difference between like, I would say the flu vaccine that everyone's used to getting versus, the COVID-19 vaccine? And
I definitely will advise her to get it. We know that African Americans and Latinos, we are getting COVID disease up to 3 times more than white Americans. Then we are in a high risk for this condition. We are in the middle of the pandemic, and this is a vaccine that is more than 90% effective, which we never saw before with other vaccines. Then yes, I would try to convince her to get the vaccine.
Absolutely.
Yes.
I'm going to call my grandma right after this. I appreciate that, Dr. Betancourt. Well, Dr. Betancourt, that was incredible. Thank you for spending this time with me and really with all of us explaining the differences and why the COVID-19 vaccine is so important. Is there any last things or any last messages you want to get out to everyone?
I definitely want to encourage everybody to get the vaccine. As Latinos, we are being exposed more to COVID-19. We are getting sicker from COVID-19, and we are not being vaccinated as much as we should. The vaccine is safe. Let us know how can we get you there to get vaccinated. We know there are so many challenges, but there is translators that can help you with the information. There is resources in Spanish and other languages that you can use, but please get vaccinated and let us know what can we do to get you there. But the vaccine is one of the first steps to get this pandemic over.
Just to reiterate what Dr. Betancourt said, guys, it's extremely important to protect each other. That's what it comes down to at the end of the day. Getting the vaccine is a lot of people, especially in the African American and Latino communities, are being affected at an alarming rate, and the vaccines, they're here to help, and really it's to protect one another and to get back to having life the way it was before this pandemic.